what Ozempic is doing to your liver that no one is talking about. In April 2026, the scientists at the University of Toronto published a paper that quietly broke one of the foundational assumptions of the entire Ozempic story. It turns out that Ozempic acts directly on your liver through a very special mechanism. In fact, in my studies, they found that it can actually heal the liver without even losing 1 pound. There was a 67-year-old female. She walked into the emergency room 2 weeks after starting Ozempic, and her ALT, which is a liver enzyme that picks up liver damage, was 1,616. Normal liver enzymes are under 40. Her liver was failing just from being on this drug for a couple weeks. And the weird thing about this is, how can you have two different studies? One shows that it heals the liver and the other destroys the liver. Today, I'm going to talk about the two different faces of Ozempic, and this is fascinating. So let me first start with the miracle. There was a study called the Essence Trial, published in the New England Journal of Medicine. 800 patients with metabolic dysfunction associated with a liver disease that involved fatty liver and inflammation. Every single one of these patients got a liver biopsy before they started taking Ozempic. And they tested Ozempic to the placebo for 72 weeks. 63% of the people that were on Ozempic had complete resolution of their liver inflammation versus only 34% on placebo. And just as a side note, I always think it's fascinating how powerful a placebo is. I still think that's fascinating, reducing liver inflammation with a sugar pill. Now, that was inflammation. But let's talk about fibrosis. 37% had measurable improvement in liver fibrosis. This is scar tissue compared to a placebo, which is 22%, which again, I find that also fascinating. Now, you have to realize that these people were monitored closely. They were gradually put on this drug. In August 2025, the FDA officially approved Wegovy, the same drug, for treatment of this advanced liver disease situation where you have inflammation and scarring. But here's where it gets really weird. For years, scientists assumed that it was happening because of the weight loss. You lose weight, and then you get rid of inflammation, you get rid of scarring. But a man by the name of Daniel Drucker, a man who literally co-discovered GLP-1 in the 80s, was bothered by something. He was bothered by the fact that the liver improvements in some patients were just so dramatic to be explained by weight loss alone. So in April 2026, his team published a study in Cell Metabolism. They engineered mice that physically could not lose weight on Ozempic. They gave those mice the drug anyway, and their livers improved, okay? Inflammation dropped, fibrosis reversed, without losing a single ounce of weight. Because what Drucker found was that GLP-1 receptors were hiding in the liver. So the entire field is wrong about how it helped the liver. Here's the fact that almost no one's really talking about: the FDA approval. It's only for patients with biopsy-confirmed stage 2 or stage 3 liver disease. And 99% of people taking Ozempic are getting it for weight loss, not for liver disease. And on top of that, 38% of all adults have some degree of fatty liver. Now, what you have to realize is when anyone quotes that Ozempic is good for the liver, they're quoting the study I just mentioned, okay? A very specific study on a very specific population getting a very specific dosage under medical supervision. Because you have to realize the liver benefits apply to about 1 in 20 patients. The majority of people taking Ozempic are not being monitored that closely for what's going on in the liver. And usually they don't gradually increase the dosage, okay, at the beginning. They just start you on a certain dosage and you're just on it. Now, let me come back to the lady I mentioned. It's a case study of a 67-year-old woman who started Ozempic for weight loss after bariatric surgery. 2 weeks later, she was in the emergency room. Now, again, I want to compare this. Normal is like under 40. A heavy drinker with cirrhosis might be 200. Tylenol poisoning victims in the ER with active liver failure could run anywhere between 1,000 to 3,000. She was in that range for being on Ozempic for 2 weeks. In over 106,000 patients, they found a measurably increased risk of acute liver injury in women on GLP-1 drugs compared to different diabetes medication. And the reason this was missed is because hepatotoxicity, which is toxicity of the liver, is not on the warning label. Doctors just don't check the liver before you start. So when a patient develops these mild symptoms of fatigue or mild abdominal discomfort or loss of appetite, those are just attributes that are known as side effects of the drug. But a lot of times those are not connected to the liver until someone gets bad enough where they end up in the ER. And then there's a second mechanism, the gallbladder, okay? So your gallbladder sits right underneath the liver. It's connected with a bile duct right here. And so when you flood the system with Ozempic, okay, those receptors are firing constantly, and the gallbladder essentially just stops contracting. So now we have stagnant bile that's going to back up into the liver, and you'll start getting sludge and potentially even crystallized stones, gallstones. Now in 2023, the FDA forced Novo Nordisk to add a warning label about acute gallbladder disease to the prescription labeled under Ozempic. When you're on Ozempic, you're going to eat less, you're going to burn more fat, and all this fat very quickly has to all go through the liver, flooding our liver with so much fat in such a short period of time. Under a constant duration, you can see what can happen to the liver. One of the purposes of this drainage system with the gallbladder is to help get rid of excess cholesterol and fat. Normally, when you eat real food, your gut releases this natural GLP-1. Again, this is the hormone that Ozempic is mimicking, and in our bodies, it lasts like 90 seconds, okay? Ozempic lasts 7 days. I mean, the elephant in the room is our gut, our gallbladder, and our liver were never designed to have that much stimulation. And when a lot of people lose weight very quickly, they assume that they're also losing the fat from the liver, but that's actually not true. In many cases, the liver actually increases in fat before it starts to come down. In a healthy liver, it can handle this fluctuation. But in a compromised liver, okay, we've talked about that, like 38% of the population has a problem with the liver. They don't even know it. They might not be able to handle this flush of more fat in the liver. So a lot of people ask me, what supplements do I recommend? Now, of course, I'm not biased of my own high-quality supplement line, but if you go to Amazon and type Dr. Berg supplements, you'll find more information. Now that you know a little bit about the liver, let me give you some additional data that you need to know about with Ozempic. They found when people stopped the drug after a year, they actually regained 2/3 of every single pound they lost. Their blood sugar improvements reversed. Their cardio benefit markers went back to where they were. And when they looked at body composition, they found something fascinating. They found between 25 to 40% of the weight loss on the GLP-1 drugs came from lean tissue muscle and bone loss, okay? Not actual fat loss. And some people might think, well, I'll just stay on this the rest of my life. Well, again, you got to really look at the big picture. What kind of side effects are being created from the medication? Ozempic is artificially creating these effects because the root cause, which, by the way, is a failed GLP-1 system that you had in the first place, is just not working. So you're gaining weight, you're having a hard time losing it, you plateaued. And so a lot of people just take Ozempic to kind of bypass that to get some results. What people really need to know when they're taking Ozempic is that there's an underlying root problem called insulin resistance. Having insulin resistance prevents you from losing weight. Your body has a certain comfortable level that it falls into, but below that, it's very, very difficult. There are some really important things you need to know if you're on Ozempic, okay? Number one, you need to be consuming a sufficient amount of animal protein because the biggest goal should be to preserve your muscles. And also fermented fiber, sauerkraut, kimchi. It actually can help stimulate the GLP-1. And this also means that you should be doing resistance exercise. On top of that, the most important thing is to lower your carbohydrates, because if you don't lower your carbohydrates, you're not going to be able to lower insulin, and you're not going to be able to correct insulin resistance. Insulin resistance can be reversed. An advanced liver disease with scar tissue many times cannot be reversed. So a lot of people ask me, what supplements do I recommend? Now, of course, I'm not biased of my own high-quality supplement line, but if you go to Amazon and type Dr. Berg supplements, you'll find more information.